So don't you forget the wound nutrition evaluation. You must evaluate the wound nutrition. In previous case, I present you the wound's nutrition evaluation is very important. Malnutrition status may delay wound healing. In daily clinical practice, there's a bias in medical staff and patients. When I told obese patients they have some nutrition deficiency, they usually responded me surprising fast. It means that they don't believe it. How can they have a nutrition deficiency? And obesity may accompany by micronutrient deficiency causing low micronutrient levels. And however, body mass index and weight loss may not identify this. So remember, an obese patient didn't mean he have adequate nutrition. Um, let's talk about nutrition. You may see the journal for the wounds nutrition. It's a nutrition for all kinds of wound, not only diabetic wound. And in this paper, you can see how to eat well. In eat well, we need some carbohydrate like potato or bread, and we still need some proteins and some foods. And sufficient hydration is also necessary for the wound. If you see the wound is very dry, you better check whether the hydration is enough or not. You may tell the patient to hydrate or drink water more. And then, but in diabetes, we have another issue. The fruits have much vitamin C, but if you eat too much fruit, the glucose level will increase and even beyond our control or even under medication. But if without vitamin C, the wound heal may delay. So it is important to evaluate what patient eats rather than only control glucose level. In many cases of my clinical patients, some of them have very glucose control, but they don't eat fruits. So maybe they have very low vitamin C level, and low vitamin C level may delay the wound healing. So how to balance the food intake and glucose control is important. So sometimes if you eat too much fruits in order to increase the vitamin C will lead to glucose control become worse. In this situation, maybe I will prescribe some vitamin C tabs or supplement to the patient, because if you want to learn to eat adequate vitamin C from fruits may lead the glucose control worse. So to balance this, maybe sometimes in order to heal the wound quickly, maybe I will use some nutrition supplements rather than from natural source. Just use the business items and vitamin supplement or to treat the nutrition deficiency. In summary, we talk about cause of diabetic foot symptoms and later treatment and exercise for diabetic, foot wound, and others, and nutrition evaluation as support. And don't forget to find the causes, and don't forget exercise as medicine. And the most important people don't notice is the nutrition status. If you meet a refractory wounds, just remember to reevaluate the wounds, whether if it's venous related, and whether you don't teach the patient how to do exercise, and whether if the nutrition is adequate, not just to see the glucose level. Please check the nutrition status like albumin status, zinc status, vitamin C status, and in all of these, if you perform well, I think many patients will heal more quickly. Thank you for your attendance. Thank you.